Hi, I'm Carmen, and I am here for the October edition of the Science and Research Update from RARE-X. So we met today and discussed some really super exciting updates and initiatives. And in fact, I'm going to share my screen and I'm going to walk through a couple of them with you in this quick recap. So I'm going to share that now. Okay. So the first one is that the data from the RARE-X DCP is now live on Terra. This is very exciting, and I want to show you how researchers can gain access to it. So now that it's there, we want researchers using it and accessing it. So you'll see right at the top of this page that they should go to rare-x.terra.bio. When they go there, they will see this screen, and the very first hyperlink will take them to a data request form. In that data request form, they will fill out a number of fields about who they are and their background, whether or not they have an IRB approved research study, what type of research they're doing, and what they hope to do with that data. Based on that, that will go to our data access committee to review. If they have any questions, they'll reach out. And then that researcher will gain access to a research data set based on your data sharing preferences. So when you signed up within the RARE-X data collection platform, one of the surveys that you got was a data sharing preferences survey. And in that survey, it asked you how you want your data shared. And if you essentially want all your data shared with all the researchers for all the reasons, you would say that, and it would be for general access, general purpose research. But if you had some concerns about different types of researchers and you only want your you only want your data used by researchers who are in an academic medical institution environment and who have an IRB approved study, you would have said that. And that's the kind of data access that would be given based on your preferences. So here's where that comes to fruition, is our data access committee reviews the requests from the researchers and they align it to the data based on patient and caregiver preferences. Just a side note, if you want to go back and look at how you answered those questions, because now you're rethinking it and you think like, actually, I just want all my data used by all the researchers because I just want it getting out there and helping to advance research, regardless of whether that happens in an academic medical institution or whether that happens at a biotech company. I don't care. I just want to go see what I said. At any time, you can go in and you can look at it and you can change it if you want. So those are your preferences. Once a researcher gains access, once they have been given access to the data, then they can start using that data within the RARE-X data analysis platform on Terra. Terra has some incredibly powerful tools and open source workspaces that really enable deep statistical analyses and even machine learning, all kinds of capabilities within that environment. So you as a citizen scientist, if you wanted to get started, we can help support that, but recognize that within this platform, it is really intended with those kind of purposes in mind. And so it isn't like really easy to view data. You wouldn't be able to go in there and just poke around and see how many patients in my disease community reported this symptom. Right? Because it is all in discrete data elements that is intended to be used for deep data analytics. All of those kinds of questions can be answered. And if you have a researcher associated with your community who just wants to know, like, can you tell me how many patients in your community have experienced, say, dental abnormalities and what types? We can help pull that data out, right? So regardless of whether the need within the data is big or small, we can help make sure that happens. Just for a quick review and reminder, There will be snapshot data available within Terra that is not yet set up. Now that the data is there, we're working on getting that set up. So there will be this kind of high level snapshot data where researchers can see, for example, how many patients with this particular disease that I'm thinking about launching a natural history study on are on this platform. They'll be able to just see that high level data there. That is not quite live yet, but we're working on it. The data access request form that they would submit is for this level 2 data. It's really for them to do this deeper dive into the data and see what they can learn from it. We are going to do our very best to get feedback from researchers all along the way, particularly if there are any really meaningful insights or publications that come out of it. And we're going to make sure that we communicate that back with your organizations. So very, very exciting that that's happening. Okay, next thing, this is on our roadmap. I want to share with you that RareX is preparing to launch our first Open Science Data Challenge. So this will be happening starting in March. So we have a few months yet to prepare for this. It will launch at the end of March. If you have no idea what an Open Science Data Challenge is, don't worry, neither did I 5 months ago. I thought it was a hackathon. It's different than a hackathon. So a hackathon typically occurs over the course of a weekend. People sort of hunker down and eat pizza all weekend and work in teams. Here in an Open Science Data Challenge, it tends to be virtual and it tends to occur over a longer period of time with lots of collaboration and iteration over that period of time, because it's not really just about a fun experience and a prize. It's about advancing research. It's about advancing disease understanding and therapeutic hypotheses. So this will likely be open for about 2 months. And we really hope that this will fuel all kinds of great knowledge around unrecognized symptoms in some of the rare disorders on our platform, around insights into the diagnostic journey and helping to shorten that journey, and insights around therapeutic research that we hope will fuel additional research studies. Note, this first challenge that we do is going to be focused on pediatric neurodevelopmental disorders. And so there are some organizations that are currently on the RareX platform that will not be included in this challenge. Don't worry, we plan to do these at least once a year, and are really looking to learn as much as we can in this first one and just keep doing them better and better. Now, if you are in one of those communities, if your community and the disease affected in your family is a pediatric neurodevelopmental disorder, then this part is for you. So this is what we need from you. We need you to engage your community, because the more data we have, the more significant the insights that we will get out of this challenge. In particular, we need the diagnosis survey filled out. We need that head-to-toe survey filled out so that we understand the symptoms. If you answer yes to one particular symptom, so let's say that you answer yes to hearing loss, within the RareX data collection platform, it'll automatically send you a follow-up survey. Please follow that one up and fill that one out as well. So the initial survey and the follow-up ones that get prompted from it. We will need genetic testing data. This is critical to this kind of challenge. So we need genetic test reports uploaded. We don't need you to pull the data out of it and tell us what's in it. We'll do that. We just need those reports uploaded, and then we will get that data curated. Next, what we are going to need is a few key neurodevelopmental clinical outcome assessment surveys. These are super important. We are just about to launch these new on the platform. If you were to be involved in a natural history study at an academic medical institution, this is the same kind of survey that they would use there. It is a highly structured survey to determine the impact of a particular type of symptom on your life. Let me show you real quick Here are the list of the ones that are going to be implemented in December. All of these different measures. So you see some of them are related to quality of life. Some of them are related to communication, GI symptoms, to behavior, to sleep. There are a lot of these. All of these are going to be implemented. We at RareX are going to go through and we are going to prioritize for you and your community 3 or 4 of those that are of the utmost importance to get in time for this challenge. The more, the better. But we need a consistent amount of data from each and every participant if possible. So we are going to be following up and we're going to be making this super, super clear to everybody who is within one of these communities, like exactly these points. We'll probably make some videos and we'll walk you through the demo environment on the DCP so that you can see exactly which ones we need filled out to get the most out of this challenge. Okay, last thing that I want to tell you is that we have now achieved all of the components of GDPR compliance. So I want to note, there is no such thing as a GDPR compliance certificate. They don't hand those out. GDPR compliance is more of an ongoing privacy and governance set of standards. And we are fully compliant with that today. This is a huge milestone. This is very exciting for us. And that does not necessarily mean that every patient in every country can participate because different countries have different regulations, but this was a huge one and it does cover most countries in the EU. So we will be following up with some more details on that. But I think those are the highlights. And if you missed us in the full meeting this month, I hope we see you next month. Okay, take care.